here on this Thursday. Today, Mayor Demings will start with some details on Major League Soccer and some other good news. He will discuss our goals for the week. The mayor will also have details on CARES funding and additional information as it relates to COVID-19. Mayor Dyer sends his apologies. He is not able to make it. He had a previously scheduled engagement and is not able to be here with us, but will be here next time. Also with us, Dr. Pino from the Florida Department of Health here in Orange County. We'll discuss our COVID-19 numbers and other details that are important for the citizens of Orange County. We start, of course, with Mayor Demings. Mayor?
Thank you, Dr. Williamson. What I'm going to do this afternoon is kind of change the order slightly because I believe it's important for us to hear the health update first from Dr. Pino, and I will use that as a predicate for what I will talk about after that, because Dr. Pino, I'm going to ask you to share with us a little bit about the data related to the health issues.
Thank you, Mayor. Could you put up our data? I am going to do a little bit different this time. I'm going to give you a dive in the data and how it's looking so that we understand as much as we can from the data what may be happening in our community. But before that, I want to also clarify a statement that I did last week, and I saw Lauren's face when I was saying, and then I went immediately and checked because she was looking to someone else, and she looks like saying, is that what he said? Is that true? So I did mistakenly stated that IgM test and IgG test count as a case. That is not the case, upon not intended there. They count, but they don't count as a new case as it's not an active infection. So with that, my apologies for misstating that element. And we have also an additional death. He's an 80-year-old male, black, non-Hispanic, with significant pre-existing conditions. That person died on the 9th. Our condolences to his family. It is also interesting, I want you to see in the data that most of our cases, about 50% of our cases, are happening between people between the ages of 20 and 40 years old. And this is data from May 28th to June 10th. So this is the data that we are looking at, the most recent data. And I want people also to keep in mind that fresh data could change a little bit as we are cleaning and analyzing, but we want to give you the most updated version that we have. Although it may change, those changes most of the time are not that significant. Another thing that I will, next page please. Another thing that I would like to show you is our incidence rate per 100,000. So our incidence rate, this means how many people per 100,000 have been tested positive for COVID-19. And in this case, when we got our highest was 21.4. This week, which is week 24, we are at 24.1. So if the data is valid as we have it today, and it should be very close, we are on our way up. There is no other way to describe it. Next data, please. This is our daily case count since the 4th of May. And you see how we slowly have increased our number to the point today that we have seen a significant increase with regard to the prior days. That is also something that we are looking and taking into account. Next data, please. This is the famous curve that people talk about. In the bottom, you have the weeks. In epidemiological studies, the weeks are numbered by the number of the week of the year. So that's an easy way to keep track. And week 24, we are not done yet, and is even higher than the prior 2 weeks. We have a couple of more days, 3 days more for week 24, so we expect that last portion of the line also to continue to go up. And in the bottom, you have also the number of cases, the real count per week. And week 22, we have 170 new cases, which was an increase of about 18% with regard to the prior week. And then on week 23, the week that ended last week, we have 242 new cases, which count for is an increase of 37% with regard to the prior week. But another interesting data is in the bottom corner here, is that hospitalizations, we are about the same with the state. Our health workers are getting less infected than the state as a whole, percentage-wise. Our fatality rate is lower than the state, and also our median age has decreased significantly. Last time that I talked to you, I think I mentioned, I don't have it for me, I think it was 35 years old. Right now it's 32.5, while the state is 41, and this may explain something else that you are going to see in the data later, and is that we, even with this increased number, our health outcomes continue to be okay. We continue to perform okay, and I'm going to show you that as well. Next page, please. Now, this is the data that I keep track myself for my own, benefit making these analyses. This is a rolling day percentage every 14 days. So it moves every 14 days, and it gives me the ability to understand daily, but also within the 14-day period, how the rate is going. The way that we do this is because 14 days is the transmission about the infectious period of a disease, and it coincides with every 2 weeks of our cycle in the calendar. So right now, our rolling average is 3.57, and that's not a bad infection, a positive rate to have. Many other places have 5 or 6, right? But it also has shown a progressive increase on positive rate, even that is not that bad. The next slide shows the same, but in a weekly show, so that you can see a dotted line indicates what is the projection, how it's going, and how you analyze this data, and it's clearly going up. The next slide, please. This is a slide that is also important. This is on June 7 is the last day that we have specific data, corroborated data, and verified data. And then in gray, you have total hospitalizations. So on the 7th, we have in our county's hospital, 55 people were hospitalized in total for COVID-19 as a diagnosis. It could be that someone else was there, but not as a diagnosis. So this is reported by the hospital daily to the state. And then in blue, you have the number of cases in ICU, and in orange, you have the number of cases in non-ICU. So we have seen an increase, a slight increase in the number of cases in ICU, but not that significant from May 31st to June 7th. Talking to the hospitals also, they, and I don't know how much of that data is also we can verify, but anecdotally, because we also engage in trials with remdesivir, people may need to stay at the hospital a little bit longer because of the protocols of treatment. So that may have played some role in a little increase in the hospitalization as people are staying longer to receive that treatment. But I don't know yet how many of those people are in that situation. And the next slide, please. This is the thing, last one. I don't want you to get data sick. But this is also an important data. 21% of all diagnosed cases lately have been asymptomatic people. And that's basically double from the last time that we calculated, which was at 10%. And it coincides also with what we are hearing internationally and nationally. And I think we have mentioned to you before that we believe the significant role the asymptomatic people are playing in the pandemic. Now, this could be also explained as we increase the number of testing sites and making closer to the community, more people that are not feeling sick themselves but just wanting to get tested are getting tested, and that may explain some of the data that we have seen. With that, would you like me to answer any questions right now, or?
Before you answer the question, no, I'll get into it and then we'll come back to the questions. But let me just say thank you to Dr. Pino. I wanted to do it in the reverse order of what we normally do because that has to set the stage for our conversation today about our response and recovery efforts associated with this pandemic. The reason why we are doing what we're doing, why we're wearing masks, why we're asking people to follow the CDC guidelines, why we are requiring businesses that are reopening to implement certain sanitation protocols is to keep these numbers. Now, what Dr. Pino just demonstrated to you, there's good news and there's bad news. The good news is that our numbers are still relatively low. The bad news is that those numbers are beginning to increase. As a community, we all have, I'm going to use this word, we've been through hell, okay, for several months now. And I don't think any of us want to go back. So it's really important that going forward, we not forget that we are living in a time of a pandemic, and it has its challenges. It has its threats to our overall health care. So this is not the time for our community, while we're in the midst of reopening and doing some other things, because the numbers are low, to lose sight of what we're doing. Now, he shared with you that in the data, more than 50% of these new cases involved individuals who were between the ages of 20 and 40. What have you seen going on across America? What have you seen recently going on in our community here within Orange County? Demonstrations, right? And they have largely involved people between that age range. Perhaps it's too early to really truly understand if the behaviors that we are seeing have contributed to this increase in these numbers. So today I want the people in Orange County to know that we need the collective help of our entire community to keep these numbers low. We're asking you to exercise some peer pressure over people who live here. We do not want to be in a situation where we put additional mandates in place. Earlier today, I had a conference call with the county chairs from the surrounding counties, Osceola, Seminole, Lake County, and Orange County. We have a conference call weekly where we try to have continuity in how we respond to the virus. We had Dr. Pino on the line. We had a physician from Orlando Health. We had a physician from Advent Health, and then we had some county internal physicians and other healthcare experts who were on that call. And so I asked them the question. One of the things that they were suggesting was, they said, in order to keep these numbers low, we must reiterate that our residents should be wearing masks when they are out in public, when they're engaging with other human beings. That is one of the single greatest defensive lines that we have as a community. So I'm saying to all of us, I don't want to put in place a mandate for people to wear masks, because to me, during this era that we find ourselves living in right now, where there's police community conflict and questions about police excessive use of force, I do not want to arbitrarily create a situation where there's confrontation because law enforcement has to be out enforcing whether people are wearing masks. We want voluntary compliance here within this community. So we're not sounding the alarm that we've exceeded the capacity of our healthcare system. We're not there yet. What Dr. Pino said in terms of the good news, he said that in terms of the capacity of our total healthcare system, we have capacity. But he's seeing enough now where he's saying, if we don't continue to pay attention to this, we could have a problem. We don't have a problem yet. We don't want to have a problem. So as I kind of now talk a little bit about what we're doing with reopening, as we have that conversation, the backdrop of it is this is still a healthcare crisis that we're living. There's not yet a vaccine or a cure for the COVID-19 virus in our civilized world. There's no vaccine or cure. So that means that we have to live with it, and it will live with us until that happens. So let's talk about where are we now? Where are we today? Today is June the 11th, 2020. The day that SeaWorld set aside that it will reopen its doors today, and that will move forward. I still believe that that is a good decision at this point if we continue to do it in a measured, safe, careful way. Now, also you heard recently that some of our professional sports associations are going to bring their competitive games here into our area. NBA will have competitive games, albeit without spectators sitting there, but the players will be there. And all of this will take place out at Disney. And Disney has gone through great lengths to ensure the safety of those players and the sanitation associated with the facilities that they will be living in and playing in, so that those games will be broadcast for our pleasure. We want to see those games continue. Secondly, the Major League Soccer, you've heard that they too intend to be here. But the professional sports teams had the option to go back into facilities or whatever where they would normally play, but they are exercising an abundance of caution to entertain us through the competitive games, but at the same time keeping their players safe, and the players are committed to doing that. So that's good news for our community. It's good news for America that this will continue to occur. So the other thing that we're dealing with, the economic fallout of the pandemic that we're dealing in now. We're trying to get our economy back working, get people back working. So it's a good thing to have much of this occurring as we're reopening in various ways. Then there are some people who are still struggling, still have the crisis that is raging in their lives. And so Orange County has endeavored to, through the CARES Act funding, put funding out into our community to help families, individuals, and businesses. We rolled that out this week. We're going to help families and individuals. To date, what they briefed me on, that we have now allocated some $2 million to families and individuals. Got a long way to go. Fortunately, we have $72.9 million that ultimately we want to get in the hands of families and individuals. So we're asking our community to be patient with us while we help you. We open up our portals through our online services this week. Went very well with the business assistance, not so well with the individual and family assistance, but it's gotten better. And we'll reopen that again soon, the first part of next week. We'll open it on Monday for others to come back in and apply. We're perfecting those processes to be able to process payments to get money in the hands of people. And so this week has been instructive for us. We've learned some things, and I'm very confident that next week some of the things that we'll put in place, we'll be able to pick up speed with processing the payments to individuals, where individuals and families will get $1,000. It's going to take some time for us to expend all of that $72.9 million for families and individuals. On the business side, we should be cutting checks soon to individual businesses. I believe that we had some 7,200 or so, 7,500 or so that touched our portals for the business assistance, and we have processed how many people, Diane? Well, no, that's Eric. Where's Eric? Eric, how many people we processed on the business side so far? Over 200 have been approved, and they'll have a check going soon, and we have quite a few others in the hopper, and we're going to continue with that process. So what I'm saying, pay attention to our website, ocfl.net, Orange Cares, about the information about how you can apply, either business or individuals. For the individuals, look to next week. We'll open it up again, and hopefully that process will smooth itself out. So I'm way off script today. So let me talk a little bit about what I was supposed to talk about as well. Orange County, you heard Dr. Pino, we have just under 2,700 cases in Orange County. Our positivity rate is about 3%, still relatively low, lower than the state's positivity rate of 5.3%. And we're moving forward with that. Let me just also talk about some other initiatives that are going on in our community. I want to spotlight that when we go through a crisis and when the community comes together, we come out stronger on the backside. And we've had some corporate partners who have stepped up here recently. We had the Lockheed Martin that provided $425,000 in the form of a grant to Second Harvest Food Bank, and that goes a long way to help take care of the people in this community. Second Harvest is serving 300,000 meals each day since March in this community. So it speaks to the magnitude of the problem that we have where there's food insufficiency within our community. So I have to applaud Lockheed Martin for being a good community partner in supporting that program. Additionally, the One Pulse Foundation will host its annual remembrance ceremony virtually on their Facebook page or YouTube beginning at 7 p.m. tomorrow. June the 12th, 2016 was a sad day here in Orange County. You know, I spent a lot of time that day down at the Pulse nightclub myself in a different role. I was a sheriff at the time. And here we are 4 years later, remembering those 49 souls who lost their lives. That will be upon us tomorrow. So, you know, our thoughts and prayers go out to the families who lost loved ones, and an entire community had to come together during that tragedy. So with that, let me stop. I'm gonna open it up for questions of Dr. Pino and myself at this time, and Commissioner Uribe, if you at some point want to join us, you can join us as well. When the questions get too tough, you can answer the tough questions. All right.
Lawrence Hubertino, and actually this is for you, Mayor.
All
That's
right.
okay. So I think some people are going to see these numbers today, seeing that we're higher than we were at a point of a peak, and think, why shut down then and not now? Do you feel like we're at a place where it's more important to keep the economy going because it was shut down so long? Or at what point do you think you might have to take those hard, make those hard decisions to go back and shut down again?
It's a fair question. Do we shut down again? Is it time to do it because the numbers are high? I said there was good news and bad news. The good news is that the overall positive rate in our community is still low. It's lower than it was back when we shut down. And we work every day collaboratively across the different disciplines to keep those numbers low. But we cannot do it without the people, without our residents buying into what we're doing. My appeal to our residents is really simple, that if you buy into what we're asking you to do, maybe we can avoid having to shut back down and shelter in place because the hospital capacity is still really good. That's a good thing. We're not exceeding the capacity of our healthcare system. So for me, for all of Orange County, I become the emergency manager by county charter during a crisis, and so we have an executive policy group that meets every day. We have a conference call, and we talk about decisions that need to be made. And so I've tried to put it in perspective. We're not at the point yet where it's necessary to do a shelter in place and shut things back down. We don't want to get there. So I appreciate the media for what you do, because you're part of the messaging, making certain that we are clear in the direction that we're giving to the people. And if we get the type of cooperation and the trust in your leadership, we can do it. We can come out of this together better than we found ourselves going into it. Okay.
Buenas tardes, Félix Pirela de Telemundo. Doctor Pino, una pregunta. Hoy el gobernador Ron DeSantis ya estaba hablando de la posibilidad de que los estudiantes regresen a las escuelas, quizás para el otoño, pero mientras tanto estamos viendo un repunte de la pandemia. ¿Cómo cree usted que se debe trabajar o actuar en conjunto a las comunidades y autoridades para que esta curva comience a bajar nuevamente y poder asegurar que los niños puedan regresar a las escuelas?
Con respecto a las escuelas, no he visto el plan lo publicaron hoy. Entiendo que el gobernador estaba hablando hoy en Jacksonville, creo, y el plan va a ser, lo van a distribuir luego. Estamos en comunicación con las escuelas y con el alcalde hablamos todos los días, a veces hasta 2 veces al día, incluidos los fines de semana. Y tenemos una comunicación muy abierta con el sistema escolar. Incluso le donamos al sistema escolar 160,000 máscaras que le pueden dar a las familias que se van a distribuir a través de los centros. Cuando veamos el plan estaremos más, podremos dar más opinión al respecto, pero no lo he visto. Con respecto a la comunidad, el objetivo de presentar la base de datos en detalles es para alertar a las personas de que hemos visto un incremento. Yo no creo que haya necesidad de alarmarse en el sentido de que estamos donde estábamos hace 4, 5, 6 semanas. Pero si no retomamos las medidas que nos pusieron en el lugar donde estábamos, volveremos a estar. Tenemos que usar máscara, tenemos que lavarnos las manos, tenemos que mantener distanciamiento social. The question was, with the release of the plan for reopening the schools coming the fall, if I have any opinions. And the other one was what to do to decrease the number of cases. With regard to the schools, I haven't seen the plan yet, but we are in constant communication with the school system and as well with the mayor. Sometimes we talk more than once a day, including weekends, with regard to these issues, and we have the same communication with the schools. We just donated to the school system 160,000 masks that are going to be distributed through the points that they are distributing the food, the meals for the students and their families soon. So we are getting ready and getting up for the possibility of opening the schools and how it's going to look. And the schools are developing cleaning protocols that will address those issues. With regard to the curve, so I hope that presenting the data the intention was not to be alarmist. The intention was to be observant, that it has been an increase in the number of cases, that increase is now significant, so there is active transmission happening in the community. There are a number of situations where this increase may be the reason for, but what is critical is that we demonstrated before that we can curtail the transmission if we adhere to these CDC measures. And we want people is not to relax. This is not gone, not because the economy is opening, which we support. We have to do it in a smart way, step by step, and adhere to these measures. And also, what the mayor was talking about, peer pressure, is also the pressure with your dollars. Do not shop. Do not go to places that you don't feel safe and not taking the steps that we have publicized. The best support that you have for our economy is when you purchase, when you use those services. So use the services of those who have your safety at heart. Thank you.
Let me just say this, as you all ask questions to the Spanish-speaking media or to any of the other media, we're not going to do a session after this, so ask your questions now. If you want to ask questions in Spanish or what have you, we'll respond or otherwise, okay? So, yes.
Jean-Pierre from Radio Haiti. Question for Dr. Pino. With the infected rate that are increasing, and you just mentioned the hospitalization rate is stable. What does that mean to the community?
So I always said that it's not one number, it's not one data. You have to look across all the data you are collecting and try to get a picture. And this is not my picture. I have a team of people behind me, which I'm very grateful for, that do all this analysis, and then we get together and go data point by data point. So what I'm trying to say is we have seen an increase of the number of cases. It was very slow at the beginning, now has accelerated a little bit. And we, as long as the pandemic continues to operate the way that it's operating, even today, we are okay. Meaning in the sense, younger people are getting affected, so you are expecting less of poor health outcomes. And most of the young people do not require hospitalization. So on that, that's the good news. The news that we have to follow really, if a transmission is happening and new cases are happening, it's because the measures that we have put in place has not been fully utilized by people. Meaning masking, washing your hands, keeping social distance. Because when we did that, 6 weeks ago, whatever that number is, we curtailed it. We brought it down to very manageable numbers. So we want to go back there. We wanted to wear a mask when you are not able to observe social distancing, when you are all about. And maybe you even have to work it during work time hours where you are in a congregated space. And the mayor has been very adamant about reinforcing the need to use masks by individuals on a voluntary basis. So we are advising, we're providing the mask, we are making campaigns to help people to understand that this is a fight that we can fight and win. What we don't want is the pandemic to go into people experiencing homelessness. We don't want the pandemic to go into assisted living facilities or long-term care facilities. And we have concerns about home care services. So those are the areas that we're making a lot of emphasis and focusing on it to try to prevent poor health outcomes.
For Mayor Demings, Steve Hudak from the Sentinel. This has to do with Orange Cares. According to your staff, 50,000 people visited the portal in the first 2 days. About 3,500 have actually completed all the necessary documents. There's a lot of frustrations out there. What would you say to people? There still seems to be a lot of money available to hand out, not as much as we need, but What would you say to people who are experiencing those frustrations and may be on the verge of giving up?
For those who are in need of assistance and are attempting to apply to the Orange Cares program, just say to them, be patient. We don't, at this point, it's not a lack of money. It's not a lack of will on behalf of Orange County to assist them and provide the dollars. It's just process. And so we are increasing the staffing and doing everything we can to make certain that we move that process along. All right, so I have staff here from just working behind the scenes. They wrestle with this in the trenches. So if you have questions, that I can't answer, I know they can.
Buenas tardes, Alibet Suárez para más 100.7 FM. Doctor Pino, mi pregunta es para usted. Parece ser que la mayoría de las personas y manifestantes están usando mascarillas, lo que es positivo, son buenas noticias. Pero hay información controversial sobre la eficiencia de las máscaras. Y bueno, más o menos lo que quería saber es qué clase de mascarilla es mejor para la protección y cuál es su recomendación sobre este tema.
Cualquier mascarilla es buena. Por supuesto que las mejores son las N95. Es una clasificación que hay para las máscaras. Pero cualquier máscara protege, porque lo que tú estás tratando de hacer es bloquear las partículas de saliva cuando hablas y cuando respiras o estornudas, para, tú sabes, que viajen muy lejos y alcancen a otra persona. Con respecto a son beneficiosas o no, los cirujanos han usado máscaras por cientos de años, desde que se inventaron. Son efectivas. The question was, what is the effectiveness of mask, and what are my advice with regard to what type of mask to wear? I said that any face covering is better than non-face covering. Of course, N95 are the best mask, but people find it a little bit troubling to breathe because they adjust very tightly to your face. But disposable mask, cloth, and other what we call source blocking is important, because what it does is really prevent the saliva and the droplets from traveling too far into reaching another individual.
This question was texted in from Eric Mock from News 13 for you, Dr. Pino. Dr. Pino, can you talk about the concern that you might have of nighttime club and bar activity in downtown Orlando? He said he's speaking to a business owner that doesn't know where to report folks that are not following CDC guidelines. And can you describe the efforts that maybe your team is doing to control the spread in places that are heavily trafficked, like downtown Orlando?
So with regard to where to call or email, there is in our website, there is an email in the section Contact Us that is always checked. And we have received complaints about other places, and we check. And we route those complaints to the right individuals. With regard to high traffic areas like downtown, we are not really at this point, meaning the health department, the office that I had, involved in any efforts. Our efforts right now to prevent any of these environments, our efforts right now are really, really concentrated in tracking and trace investigation, as well as testing outbreaks. Part of the reason why our cases may be up, and I haven't been able to look the data that specific, is that our strategy for testing is a little bit different than other places. We really want to find the positive cases, in the sense that when we learn there are 2, we go and test there and find 5 more. And we learn that it's 4 in another place, and we do a good another 300 tests. We are finding, and that may be why we have seen an increase also in the number of asymptomatic cases, because we are really looking for these cases. And despite some suggestions in the past by conspiracy theorists, we are not hiding any numbers. We are providing all the information that we have, and we will dig this out. We have to work it, we have to look for it, we have to find it.
This next one is for you, Mayor Demings. This is from Ryan Lynch in the Orlando Business Journal. This is in regards to the spike of cases. Mayor Demings, is there planning for a scenario where we may have to scale back businesses' openings? What might that look like?
We're not there at this point where I think we have to scale back. What has been put in place, if people adhere to it, should work. Now, if you're a patron of a business and they're not exercising the CDC guidelines, the social distancing and everything else, I wouldn't patronize that business. And those businesses that have some type of regulatory oversight from the Department of Business and Professional Regulations, because they have a liquor license or some other type of license, they could jeopardize that. If they're blatantly failing to follow the guidelines, there are consequences of that. It has to be brought to the attention of the various authorities. And then lastly, this is all designed to be preventative in nature when we institute those sanitary measures. Businesses that knowingly fail to meet those guidelines, I believe, open themselves up for litigation. And so if I were a patron and I went somewhere and the business was not following the guidelines, I'd keep that in mind if I developed the virus and I can point back to where I got it. So they can be held accountable, is what I'm saying to you, ultimately, and that's what I would offer in the way of caution to businesses that just think that this is all fun and games. It's not. Okay. Where is the mic? Okay. I think that's it. So thank you all for coming this afternoon. We will conclude this. We hope you have a good weekend.